My advice, as a young adult cancer survivor myself, would be you're not alone. Although cancer is rare in this population as compared to children and older adults, there are other people out there, and you can find help.
I think what you need to do when you're diagnosed is allow yourself to accept it first, and second, get help, get support. So the greatest advice that I could give is make use of your support network, make use of the people and family and friends in your life. They will help you get organized, informed, and ready.
If I were approached by a newly diagnosed patient, I would say, number one, you want to go, if you can, to a center where there is an appreciation that young adults with cancer are different than a child and an older adult. Number two, that they have become familiar with the new information that's coming out about young adult cancer, the issues that young adult cancer patients face, and that they are able to address those issues with resources that are either at their institution or available in the community that they have connected with.
Find a doctor you're really comfortable with. It's okay to try 1, 2, 3, even more than that, until you find somebody that you feel has your best interests at heart and is going to give you the attention you need.
Don't be afraid to ask the questions, particularly about clinical trials and getting a second opinion.
I think the most important thing to tell a young adult who's just been diagnosed is that they're not alone, especially if you consider a young adult in an adult cancer center. Oftentimes, the majority of patients around them are going to be significantly older than they are, and they're going to feel really isolated. So letting them know that they're not alone and that there is a young adult cancer community that can help both in terms of getting through treatment, but also in terms of finding peers and working through unique issues like, what am I going to do about fertility? What do I tell my potential spouse? What do I tell my employer or my school? That there's a lot of young adults that have been through this, and they don't need to go through it alone.
If I could go back and do it again, I would definitely look for the support system because it is there.
My recommendation for an adolescent or young adult who's just been diagnosed with cancer is to seek out care, preferably in an NCI Comprehensive Cancer Center. If an NCI Comprehensive Cancer Center isn't accessible to them, then an academic institution that participates in clinical trials. That's what's really important.
This is a time in your life where you're learning a lot about yourself. Not just about work and where you're headed career-wise or who you're going to marry, but also about how to take care of yourself. And in many ways, what an opportunity, that seems like such an odd word, but what an opportunity to kind of take this time to figure out the best ways to handle loss, to handle anxiety, to care for yourself in these times. And
the best thing I ever did was have somebody sitting in the room with me who wasn't attached to me, who could ask questions that I wouldn't think to ask, that my husband wouldn't think to ask. We were new with cancer, so how do you know what you're supposed to ask? You don't. So have an advocate with you, contact outside organizations that can help you through the process and tell you what kind of questions you can ask.
It feels good to talk about it with other people or just have some way to vent. So I'm kind of an introvert by nature, and I actually started a blog. It was sort of a forum for me to, get my feelings out there and just, so I'd encourage that. I mean, it's not for everybody. But I think it's useful.
You can find a whole community online. Even if you're home alone at 3 o'clock in the morning, you can probably log on and find another young adult who you're sharing experience with.